Robin Gurwitch is a professor of psychiatry and behavioral sciences at Duke University. She joins us now for more on all this. And Robin, thanks for joining us to discuss a very important issue in the context of what's happening with COVID. First, put it into perspective, the size of the problem that students in the U.S. are currently facing, and if we're seeing it more or less in specific demographics, parts of the country, urban areas, rural areas.
Sure, a big question. First of all, thank you so much for having me to discuss this issue. I mean, in the United States, we have close to 60 million, something like 56 million children in schools from kindergarten through high school. So it's affecting many, many, many children and their families and their caregivers. What we have to recognize is right now, there's not anyone that would say schools aren't a good place for kids to be. But that doesn't mean that we just quickly just open everything back up. I think that we need to recognize that as important as schools are, as important as in-person learning is, not only just for the academics, but as the report talked about, the social and emotional connections in schools. We need to make sure that schools can reopen safely, because there's also the concerns, there's increases in worry and anxiety about COVID, and children can get sick, and children have died. Many children have died, or they bring it home and a family member contracts COVID and dies. So we do need to, it's not an either or, it's a win. And different parts of the country in the United States are handling it differently. Some places have gone back, some places are still part virtual, part in person, and some are still virtual. I think with the vaccine rollout, we'll see more and more schools putting some procedures in place to allow for more in-person learning. So I think that's a big and very hopeful sign that we have on the horizon.
What sort of resources are available for students and parents, caregivers, who are struggling with this?
A great question about resources. So as schools are reopening, I truly encourage parents and caregivers to make sure that they have some connection, whether it is through the online platform or other ways, to know what's happening so they can be knowledgeable about what's going on. The other thing we know is that, unfortunately, one of the things this pandemic has done is point out the fact that we have a true need in the United States for more mental health professionals. The need for mental health services far outweighs the number available. So we do need to increase accessibility and numbers. Telehealth has certainly helped to get services out to rural areas where otherwise they may not have, but there are great resources out there, and I think that's important. Anytime you're worried about a child, there are resources, there are treatments that are incredibly effective. There are services that can be found through the National Child Traumatic Stress Network. If you look at that website, it will give you a list by state of resources. Your local mental health association, check with your physician, and they can get you connected to mental health professionals that offer the evidence-based treatments that we know work. There are more services in schools that are effective as well. But as schools reopen, we also need to do assessment to find out which children are in need, where the greatest needs are, so we can better address those.
And Robin, really briefly, if we can, this isn't a uniquely American problem. Are there other countries dealing with this better?
You know, I wish I had an answer to that. I'll be very honest and say I'm not sure. I think every country is struggling, and there really is not a one-size-fits-all. So every country is going to have to look at not only rural versus urban, but where are other disparities, where are there other pockets where people aren't getting the services, and come up with a game plan and get that in place as schools are reopening.
Robin Gurwitch from Duke University, thank you for your insight.